Hello and welcome to Downriver Rescue Connection. I'm your host, Patty Radikovich, and it is my privilege to bring you information on animal-related topics in the animal rescue community. On today's episode, our guest is a friend of mine. This is Mary Ortiz. She is a licensed vet tech, and she works at Cahill Veterinary Hospital. So welcome to the show, Mary.
Thank you, Patty. I'm happy to be here today.
Yeah, I'm so glad that you decided to be on. We wanted to do a special show. People always ask questions of vet techs, and they want to know, what can we do for these little situations that come up? And I wanted to have Mary to come on and talk to everybody and let them know, what do you do about these basic situations? So before we actually get started with Mary, Basil's Buddies has some adoptable animals that we're going to show on today's episode as well. So I'd like to ask Julia Funds, who is our vice chairman, to come and bring Oreo out, who is one of our newest adoptable cats. So Julia, if you can tell us a little bit about Oreo.
Yeah, Oreo is a 3-year-old female. She is spayed, fully vetted. We rescued her from a local shelter when her family moved, and unfortunately, Oreo was not allowed to go on that move with them, so we pulled her in. She's a very sweet, quiet, loving girl, and as Patty mentioned, she's looking for her forever home.
Yeah, so if you're interested in Oreo, you can go to our website and find out where our adoption events are, or you can fill out an application online, and we will look over your application, and we can set up a meet and greet once it's approved. So thanks, Julia.
You're welcome.
All right, so Mary, why don't you tell us a little bit first, what is a vet tech? What does a vet tech do, and how does it differ from a vet?
A lot of people ask that question. A vet tech is somebody that assists a veterinarian. The state of Michigan does require that in order to be called a veterinary technician, you do need to be licensed through the state. You do need to go to school and get a degree, and then you take a exam, just like a veterinarian would take like a board certified exam, or a nurse would take that. We do the same thing. Once you are licensed, then you can practice as a licensed veterinary technician. And some of the duties that veterinary technicians do on a daily basis are drawing blood, placing IV catheters, assisting the doctor during surgery, performing dental cleanings, performing radiographs. So those are some of the common everyday situations that a vet tech would do.
Great. Well, thank you. And if we have time at the end of the episode, we'll talk to people a little bit about how can you look into a career of becoming a vet tech. But we have a lot of information we want to get across, so we will start right into it. So one of our models for today is Crandall, we call him. His name is Sir Winston Crandall, and he's actually a Basil's Buddies dog. He was a dog that we actually pulled from a local shelter. He's a senior pet that unfortunately somebody decided that they didn't want him anymore. He's about 13 years old, so we pulled him from the shelter, and we were going to put him up for adoption. Unfortunately, we found out that he has a lung disease, so he is one of our hospice animals now. That's something that our group does do. But he's decided he wants to come on and be our model for today. So one of the first things that I wanted Mary to talk about, and he's going to catch the fly that's running around the studio for us, hopefully. One of the things I wanted to have Mary talk about is a lot of people have senior pets, and one of the most common questions you get is, well, how do I know what's a normal sign of aging, and how do I know when there's actually something wrong and I need to take my pet into the vet hospital? So can you talk about some of the common problems that people see with seniors?
Sure. Some of the things that you might notice as your dog is aging or your cat is aging, that they might be slow to get up if they've been laying down for a little while, slow going up and down stairs, maybe not greeting you as fast at the door when you come home. Those are all signs that there could be maybe some arthritis going on, and there's definitely things that can be done. So it'd be a good idea, if you're noticing symptoms like that, to make an appointment with your veterinarian so that they can discuss either pain management if it is arthritis, or maybe there's something else going on with them. But certainly things that you can do at home, like with Crandall here, he's got a nice comfy bed. They make like those memory foam beds, just like for people. They make those for the therapeutic. They call them like the therapeutic beds. Those work really great for their bones being arthritic. Other things that you can do is they make steps that you can now put up to like your couch or put up to your bed if you like your dog to sleep with you or get on the couch and cuddle with you. Those are all things that you can do just to help them a little bit. If there's stairs going outside and they need to go up and down, you can make a ramp for them so they're not actually going up and down those steps. Those are all things that can just help alleviate some of the arthritis for them.
Great. And as far as, like, I know people wonder about eating habits. People want to know, do they slow down with the amount of food that they're eating when they get older? Are they supposed to gain weight when they're older? These are all questions I know people ask all the time.
Right. Slowing down as far as like if they are not wanting to eat or they're reluctant to eat, those can definitely be signs that there could be something going on. You want to make sure that they're maintaining a healthy weight, which would be not being obese. If they are having some issues with arthritis or hip and knee problems, you definitely want to make sure that you're keeping that weight off of them. And we see that often where many dogs and cats come into us and they're a little on the chunky side. So it's important as they age that you help to keep kind of that weight down so that they're not carrying around those extra pounds. But if you do notice changes in their appetite, either they're wanting to eat more or they're wanting to eat less, those can certainly be health problems that maybe there's something going on, a thyroid issue, heart issues can cause them to not want to eat, things like that. So definitely a situation that a veterinarian should see.
Okay, and then a lot of times too, seniors often need dental cleanings because their teeth are getting a little bit scaly, and that can actually cause heart issues and other problems with the bacteria coming through the mouth.
Right.
So definitely it's a good idea. And when your pet's a senior as well, it's usually recommended that you increase the number of times that you see the vet per year because they age a lot faster than we do.
Yep, we do recommend that you bring your pet in every 6 months for a regular exam. If you've got an older dog that's on maybe chronic medications for maybe hip problems or kidney problems or heart problems, we do recommend every 3-month exams.
Okay, great. Well, thank you. Now we had people submitting questions to us, so I want to make sure that we get those things covered. So one of the things that's the most common calls that you guys get in is, I was cutting my dog's nails and I cut it too short and it's bleeding all over the place. What do I do? So what do you tell people when they make those phone calls?
Cutting nails is definitely something that most people can do at home. It's something that is not an issue. I mean, certainly if you have a dog that's well behaved or a cat that's well behaved and you want to cut their nails at home, certainly give it a go. And sometimes it happens. You cut a little too short and now they're bleeding. Things that you can do at home if you don't have Quick Stop, which is like a powdered styptic that you can get at the pet store. You can use just regular flour or baking soda. You can even use a bar of soap. If you get a bar of soap and you get a little chunk off, but you just basically want to pack it right onto that nail and put a little bit of firm pressure on it. Always be careful that you don't get bit because it's definitely painful when you do that. So use caution when you're doing something like that.
Yeah, and we have some of the nail scissors over there that we don't usually recommend the guillotine style scissors. So these are
just a couple of the different. These work really good for like little dogs, like maybe a Chihuahua or for cats. And this style works really good for bigger dogs and maybe even medium-sized dogs like a beagle or something. These work really great for. And they do sell this style at most of the pet stores and online that have a little guard on them. This one doesn't have a guard, but they do have a little guard if you're a little bit worried about cutting too close. So these are all just some ideas.
And I just wanted to give a little caveat in there. It's a little funny story. As I was explaining to somebody once that's what you do is, she called me and said, I don't know what I did. I cut the quick and his nail's bleeding. And I said, well, you have flour, cornmeal, something. Go ahead and put it on there. Well, she called me later. It's about a month later. And she's like, I don't know what to do. My dog's ear is bleeding and I can't get it to stop. And I'm like, what have you tried? And she's like, well, I put flour on his ear. The flour and cornmeal trick is only for the nails. So please do not try to put that in other wounds. And we're actually going to talk about in a little bit, we're going to talk about what do you do if you do get a laceration on your animal. How can you help that to get it to the vet in time? But please don't put flour on other lacerations.
Yes, I agree.
So another common call that you guys get is, my dog ate something that they're not supposed to eat. What do I do? Is he going to die? Do I need to take him in? What do I do? So, like, let's say, you know, somebody's dog ate a bottle of pills, which is what my dog does. Ate a bottle of pills. What do you tell somebody to do in that case?
First of all, we would recommend, you know, ask what did they eat, and it depends. If it was chocolate or a bottle of medication or onions, something that is dangerous like that, that can cause problems if they get too much, we would try to get them to have the dog vomit at home first, because any time that it takes you to get from your house to the vet is critical. So you can try to make them vomit at home by using regular hydrogen peroxide, and I have a bottle of it that I just wanted to show. Just the regular hydrogen peroxide that you get at most of your pharmacies.
Just remember the brown bottle, the hydrogen
brown
peroxide.
bottle, not the alcohol. Very important. Basically, what you're going to do is you want to start out with a tablespoon of hydrogen peroxide. You can give it, you know, just give it by mouth. Most dogs and cats will foam a little bit when you first give it, and that's okay. You want to wait 10 minutes, and if they don't vomit in that first 10 minutes, you can give another dose. You don't want to ever exceed 2 tablespoons. And if they still haven't vomited at that point, they definitely need to go to the vet. But always call your vet to make sure that it's okay to, you know, whatever they've ingested, that it's okay to try to get them to vomit. Things that they could eat, like a battery or maybe a nail. I mean, we've had that happen before, or a sewing needle. You know, those are all things that you don't want to try to get them to bring back up. So always call your vet to make sure.
Okay, great. So another common thing that people actually want to know is, okay, what happens if their animal has an emergency and they need CPR and they want to be able to get the animal to the vet in time, because we don't have ambulances for pets like we do for people. So they're trying to rush to the vet or rush to the emergency vet. So we actually brought some, people are wondering why we have stuffed animals here today. We actually brought them for you to demonstrate, to show how to do CPR on animals.
Okay.
So if you want to walk through it.
Sure. So I have, this is going to be our demonstration for either a small dog or a cat, and by small I mean under 30 pounds. What you want to do is, first of all, you need to check for a pulse to make sure that they, you know, definitely are not breathing and don't have a heart rate. And where you'd want to check for a pulse would be, you know, right here at their rib cage to check to see if they have a heartbeat.
Turn it to the side this way so you can see.
If they don't have a heartbeat and you're not able to see that they're breathing, what you want to do with them is you want to lay them on their right side down. So you're going to put them on their side just like this. And with a small dog or cat, you're going to take one hand and you're going to place it underneath their chest here. And you're going to take your other hand and place it on top of their chest. And you notice that I'm not using my entire hand, I'm just using my fingers, okay? It's very important to know that. And what you're going to do is you're going to give compressions just like this. And basically, I try to say 1-inch compressions for small dog or small cat. So you're going to do 5 compressions, and once you do your 5 compressions, then you can breathe for them. What you want to do when you breathe for them, and I'm going to just turn them around so that you can see, you want to take your entire mouth and put it over their nose and their mouth, and then you're going to breathe into it, okay? So you're going to do 5 compressions, and then you're going to give them a breath. You're going to do 5 compressions, give a breath. So each time that you do that, you know, give a breath in between those 5 compressions. After 10 to 15 minutes, if you're not getting them back at that point, you can stop. It would be ideal if somebody was doing compressions and somebody else was driving, you know, to the vet, okay?
Right.
But sometimes that's not always, you know, ideal if you're home by yourself or a situation like that.
Right.
So,
or if you're really talented, like our Vice Chairman Julia, she's actually given CPR to a kitten while she was driving.
there you go.
So, and it made it, right? So,
Good. Okay, and then I'm going to demonstrate on a large, what we would consider a large dog.
and when you do hear the term nose to or mouth to snout breathing, this is what she's talking about. With
Right,
mouth to snout.
exactly. So we're going to do the same thing. We're going to lay our dog on their side, and you always want to make sure that they're on a firm surface. So if you have like a small dog or a small cat, you can put them onto like a table. That would give you a little bit easier to do. But if you have a large dog, laying them on the floor would be perfectly fine. What you're going to do is same thing, lay them on their right side, and you are going to take both of your hands and you're going to place them over the chest. You're going to do 1 to 3 inches. Now with the small dog or cat, we talked about only going in 1 inch. You're going to do 1 to 3 inches. You're going to do 5 compressions, same thing. You'll do 5 compressions in a row. And then what you're going to do is you're going to then breathe for them. You're going to place your mouth over their nose, and you're going to breathe right in through their nose, as opposed to with the small cat or dog, you would place your entire mouth over their snout. Once you do that, you do the same thing, 5 compressions to 1 breath, 5 compressions to 1 breath. If you have a dog that's over 90 pounds, you want to do 10 compressions to every breath. So just remember that. If you've got a very large dog like a Mastiff or a Dane or something like that, it's 10 compressions and then 1 breath. And you want to do that, like I said, at least for 10 to 15 minutes to try to get them back. Okay. Other things to check for is if you've had a dog maybe that was chewing on a bone or a rawhide or something like that, always check to make sure that they haven't choked on something and that there's nothing lodged in the back of their throat.
Right. And that's, and you know, and when people, I know sometimes people get worried about trying to remember, you just do the best you can and try to get to the vet, you know, as soon as possible. And like, so that if you have somebody that can drive while you're doing this, that would be the most ideal situation.
Right.
And you know, that's another reason why you don't leave your animals with rawhides unattended, because they can actually bite off pieces and choke on it.
Right.
So thank you for that demonstration.
You're welcome.
So now we're going to see if Crandall will be a cooperative model today. Another acute case that comes up is if the animal gets cut and gets a laceration. That's actually pretty bad, and you need to take it into the vet. So we want to know, how do you safely transport your animal to the vet to minimize the bleeding? Because clearly you need to take them in and you don't want them to bleed out while you're going. So what are some things that you can do?
Some things that you can do at home is most of your lacerations or cuts typically will be on their paws or on their leg. So you want to try to apply some pressure, and things that you would have at home would be like a washcloth. Most people have an ace bandage that you know could be laying around, and a little bit of tape, because you need to, you know, keep that on. And this is something that is going to be short term. It's for you to put this on and drive to the vet. It's not, you know, to put on and leave on. So let's see if Crandall will be cooperative for us. Okay.
And keep in mind, he's a senior dog, and sometimes seniors are cranky.
Yes. So we just have our, you know, washcloth and then some ace bandage. So we'll see. I'm not going to tape his leg, but you guys can use, you know, if you got duct tape, I mean, whatever you've got, you can use, okay, to tape it on once it's on.
Hey, baby.
Okay, Crandall.
Hey.
Here, come here, buddy.
Let's
so we'll see if he's going to be cooperative. So say he's got, you know, a cut on the bottom of his paw. You're just going to take the washcloth, you're going to apply it, you know, some pressure there, and then what you're going to do is just take your bandage and you just want to wrap it around.
He's thinking,
You're
what are you doing?
You're being better than I thought you were going to be.
That's only because he's getting food rewards while we're doing this to him.
So once you get the bandage on, you could apply, you know, like maybe some tape around the top here just to get it to stay.
And we're going to take this off of him just because we don't want to stress him out any.
Are you over it?
Thank you.
Good boy, Crandall.
Thank you.
So he was actually really good. If they were to get a laceration, maybe, you know, on their back, or sometimes I've seen ears, you know, lacerations on their ear. You know, those types of things are a little bit more difficult to bandage. You know, if you've got, hopefully maybe there would be 2 people at home, one person can just apply maybe the pressure here while you're driving to the vet. Those are things that you can do at home.
Right, and the thing is, like, you know, don't lose time while you're trying to apply the bandage if your dog is uncooperative, like, or your cat's uncooperative, like, get it to the vet as soon as you can.
Obviously, if they're trying to bite you or something like that, it's a no-go, just get them to the vet.
Right. Okay, so I want to bring out another one of the animals that we have. This is a kitten that actually we just got her into the group. She actually was turned into your clinic, Cahill, and she's not available for adoption yet. But Julia, why don't you talk a little bit about her?
This is little Autumn. I named her Autumn because I got her the first day prior to the official day of Autumn, and she's about 7 weeks old. As Patty mentioned, she was turned into Mary's Vet Clinic by one of their clients who found her, I believe, was in the middle of the road. She was infested with fleas, severely anemic, and just a very sick little kitten. She's bounced back quite well. She is available for adoption once she has all her vetting done. We're waiting a little bit longer because she still needs to gain a little bit of weight and get a little bit more healthy before we can get her spayed and vaccinated.
Great, thank you. So one of the reasons we wanted to bring Autumn on was because this is actually a common problem people see, and with the winter coming up, it's actually very common. Is people will see kittens abandoned, you know, just by themselves.
Right.
So what do you tell people if they call you and say, hey, I see an abandoned kitten, what am I supposed to do?
You know, definitely it's a common problem. I always recommend that first to make sure that it's definitely abandoned. A lot of times if a mother cat feels that they're threatened or they're, you know, this area that they've had their kittens in is not safe anymore, she will take them and move them to a different location. So it's important to make sure that she isn't on the process of maybe moving the other kittens to another place. So you might want to just, you know, keep an eye on it, check the area, maybe leave, and then maybe an hour later come back and just see is that kitten still there. Obviously, if it's a kitten on the side of the road or on 75, you know, the expressway, and they're going to get hit, you'll want to pick them up. But things that you can do is bring them in, but you can bring them to the vet, have the vet look them over, make sure that they're healthy. Certainly contacting a rescue group if it's something that, you know, you can't keep the kitten. Those are all things, you know, to look for. Make sure that they're not covered in fleas and that you're not bringing them into your house if you've got other cats in your house or dogs. You don't want to bring them in if they're sick. Certainly cats carry diseases too, so if you've got healthy cats in your home, you never want to bring in another cat without it being checked out first before. So
exactly. Okay, well, we only have time for probably 1 or 2 more questions that came in. So one of the things that that people do incorrectly is flea and tick medication. They don't apply the flea and tick medication correctly. So can you talk a little bit about that and how you're supposed to apply it?
Yes. Flea and tick medication is really important to make sure that you apply it correctly. It's also important to know that if your dog has fleas or your cat has fleas, you have fleas in your house. And I know people don't want to hear that and it grosses most people out. But if you're seeing fleas on your dog or cat, you have to treat your house now at this point. But if you're using it as a preventative, we want to make sure that you're applying it correctly. And I have a product here that I'm going to demonstrate on Crandall. And I'm not going to actually apply it because he's already been on it, but I'm going to show you how to do it. Most of the products come in a container like this, and there's a little line here that you'll want to break open. And what you're going to want to do is you want to make sure that you're applying it between the shoulder blades, which are up here on the back of their neck, and it just needs to be somewhere in here. We recommend between the shoulder blades because that way that they can't lick it or get it off of them. It's important to make sure that you're parting the hair. As you can see on Crandall, he's very fuzzy and very furry. So you want to part that hair until you're seeing the skin. And you're going to apply it directly onto the skin here. And you want to do the entire tube that you're given. so that you're applying the entire product.
Okay, and then one thing too is that we hear a lot that I just want to point out is flea and tick medications, especially if they're liquid. Those are topical. They go on the skin, and unfortunately, you guys get phone calls. I know. Well, I gave them the flea and tick medicine, and they didn't like the taste of it.
Yes.
You know, please make sure you're following the directions that are on the package, that you're following the directions from your vet, because it's a topical medication. It's not going to work if you give it to the dog orally, and it's actually could make the animal sick.
Right, exactly.
So we are just about out of time, so I want to thank you so much for coming on the show and talking to us and sharing all this wonderful information.
Thank you for having me.
Yeah, so we may ask Mary to be brave and come on the show again at another point if we get more questions in. And if you have any questions, you can go to our website, or you can go to their website and check them out. Come here, Crandall. And I just wanted to say that we all look forward to a day where all pets are treated like family and everyone has a home. Until that time, we invite you to be part of the solution. And remember, please spay and neuter your pets. See you next time.